Afternoon, everybody, and let me apologize at the outset for the little delay we have. Usually, we start on bang on time, but well, nevertheless, better late than never. And the hot topic of today's discussion is hypertension, and we are. Why are we on this throes of discussing hypertension? Is that it is a very big lifestyle problem. It is a definite change in our body systems, and we need to, how should I say, we need to be very aware of it. And one of my favorite dialogues always is that it is the world does not become dark because we tend to close our eyes. So let's go through what do we mean by hypertension. Very simple, that very simple logic or the physics of any fluid is that the blood will always flow from high pressure zone to the low pressure zone, and the highest pressure has to be maintained by the heart. Eventually, people who develop hypertension, whatever is the cause, the body starts resisting this flow or this pumping of the heart, and the body pressure starts increasing. And to maintain the balance, the heart starts increasing its pressure. So there is a lot of resistance. So when we look at a typical blood vessel in a hypertensive patient, the normal patient, the elasticity of the blood vessel is very good. People who have a little pre-hypertension, or they are on like the borderline or the high normal, I will tell you how that high normal works. The elasticity starts going down, the pressure on the blood vessel wall is very high. In people who have hypertension, that doubles, the pressure doubles, right? When we classify hypertension, to be very simple, any pressure which is less than 120 by 80 is normal. Up to 120 by 80 is normal. 120 to 139 systolic, 80 to 89 diastolic, at the upper and the lower. These are not limits, they are two different levels. Systolic blood pressure is one level, diastolic blood pressure is one level. Systolic blood pressure represents the heart, the diastolic blood pressure represents the peripheral, the body. So it is high then. In the stage 1 hypertension, 140 to 159 and 90 to 99. Stage 2 is above 160 over 100, and hypertensive emergency is any blood pressure which is over 180, 120. So no more ambiguity about whether 130, 90 is high blood pressure or not. Yes, it is high blood pressure, and we will see how we are going to manage this. What are the symptoms? Essentially, there may not be any symptoms because these changes take place in your body over a period of time. So slowly it will keep building up till the time that it hits so high that you need medication. So one of the best way to do is to keep checking, especially when you have a very strong family history. The other simple symptoms can be vague chest pain, discomfort, palpitations, heart, short difficulty in breathing or shortness of breath, like you walk a little bit and you start feeling breathless. Claudication, that means you get pain when you are walking, headache, dizziness, visual disturbances, and swelling over your feet. How do we make a diagnosis? One is never made a single, there has been no diagnosis at all. You have never gone to a doctor, but the first time you walk in, we see that the blood pressure is on the higher side. Then we say, then we look at what stage it is, whether it is normal or whether it is pre-hypertension or it is stage 1. Up to stage 1, we can probably stagger it out in the next couple of weeks, repeated monitoring, do some lifestyle modification, cut down your salt and cut down your oily food, drink more fluids, go for a walk, recheck in different times of the day. But if the BP is high, that is at a stage 2, 160, 110, 100 above, or more than 160, 100, we definitely need to start basic treatment and then start investigating. What are the classification? That means there are two types of, one is primary, which is the most common. there is no cause. It is called as essential hypertension. That means either you have family history or you have no cause for this hypertension. The secondary causes are those which, if you correct the cause, then the blood pressure can become normal. Chronic kidney diseases, vascular hypertension, different hormonal changes, because of hormone, um, growth hormone in a high, Cushing's disease because of chronic steroid usage, um, obstructive sleep apnea, very, very, very common. What is obstructive sleep apnea? Something which we'll discuss, but briefly I will tell. Very common in male, and it is presented by a very, very common symptom called as snoring. I always snore. My family gets disturbed, but I am not. But believe me, snoring is never normal. It is a very male thing. For the ladies, the snoring, cause of snoring is a little different. But in male, even a normal BMI person can have snoring because the base of the tongue becomes thicker, and when they sleep with their mouth open, and there is regurgitation, there is flapping of the tongue, and there is snoring. So yes, that is what is called as sleep apnea. Possible risk factors, typically like any risk factors, we divide it into fixed risk factors which cannot be changed, and the changeable risk factors. So what cannot be changed is your family history, your gender, your age, your race. These are the things which we cannot change. What we can change is weight, stress, diet, use of addictions like smoking, alcohol, drug usages, hormone preparations, bad lifestyle, and maybe multiple combination of all these things. Yeah. So how do we investigate? So first thing we investigate, first thing is monitoring, serial monitoring, and then we start looking at, has these high blood pressure already started making any changes, and we look at the target organs. The target organs are eye, kidney, heart, the blood vessels, and we also try to find out if there are any obvious secondary cause of hypertension which can be easily treated. So we look at ECG, we look at echo, we look at the chest X-ray, and we look at the renal parameters, because renal parameters decide mostly what type of medication we use for the patients. And then we do other tests to carry out the secondary hypertension. But secondary hypertension, by and large, we only see in people who are very young and who are come with high blood pressure. So lifestyle modification then comes to the management part of it. Very clearly it is, the first three is lifestyle, 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 and everything else has to go parallel with the lifestyle. So how do we do? The ideal BMI, global BMI is 24.9. So we need to bring down the BMI to less than 25. But for Indians, we make it more stricter and say, yes, you need to have a BMI of 22.6. So because we have seen that even between these BMI, there are risk factors which can cause a heart attack, which can cause a stroke. Regular aerobic exercise like brisk walking, cycling, jogging, swimming, minimum 45 minutes a day, 6 days a week. One day you can take a rest, not a problem. Limit alcohol, avoid if you can, but limit definitely. Cut on the salt intake to less than 5 grams per day. Most countries do tend to take a little more salt, but for Indians, we've realized that at 5 grams per day is what we want. Then there is something called as a DASH diet, which is dietary approach to stop hypertension, which I'll take it up a little later. Smoking cessation. Alcohol, at least we can say in moderation, but smoking has to be stopped because hypertension and smoke are the sure shot risk factors for stroke. One shot and then you're down. And dietary saturated fat and cholesterol. So avoid all these processed food, puffs, pizzas, all things. Decreasing coffee intake. Coffee is a high adrenaline stimulant, and if your pulse rate remains high, then the blood pressure will also eventually go high. What is DASH, dietary approach to stop hypertension? Diet, is that we need to decide how many serving of some of the essentials. So we look at 6 or 7 things. We look at grain and grain products, we look at vegetables, we have fruits, low fat or fat free dairy foods, we have the proteins, which is the meat, fish and poultry, and then we have the dry nuts, seeds and dry beans. So how do we recommend? We recommend most of this as a serving per day. So grains and grain products 7 to 8 serving, vegetables 4 to 5, fruits 4 to 5, the low fat diet or the dairy free food, fat free dairy food is around 2 to 3 times, meat and fish and poultry less than 2 or per day, and nuts, seeds and dry beans 4 to 5 servings weekly. It does not help to have nuts and seeds every day, because essentially they are oil based also. So this is if we are looking at a calorie count of around 2000. If you want to cut down this from 2000 because you are doing a weight loss, then we have to do like an individual measurement and try to bring down whatever is needed. Most important part of hypertension management is patient education. Why do we have hypertension? The commonest question which I have been asked is, you are having symptoms, you are not feeling good, you know you have hypertension, but you are resisting taking treatment. So the typical answer, and I am sure all of you know this answer, is that once you start treatment, it is going to be lifelong. But my dear friends, the most important part of it is, whether you take treatment or not, the high blood pressure is going to be part of your life lifelong. So is it not better that we treat it and keep it under a good normal control, so that the complications which is going to come because of hypertension do not arise in the first place? So it is better to take a small pill, control the blood pressure, try to do lifestyle modification, and maybe a very small percentage of people may not need long term medication. But that can only be said if you do a early detection of hypertension, you catch the blood pressure before it becomes stage 1 or stage 2, you are in pre-hypertensive stage, take the pill for some time, do your risk stratification, get on with your lifestyle modification, and then you may not need the pill. We have people who, I know so many people who are maintaining their blood pressure at 110/70, but 2 things which they do. They keep an eye on their everyday routine and they come for follow-up. Not coming for follow-up with the fear that if my blood pressure is high, I will be put on medication. You are doing more crime against yourself. You are neglecting yourself more than any actual prudence here. The next thing is that you need to check the blood pressure monitoring at the same time every time. We cannot, the serial monitoring is a different thing, but when you are trying to monitor your own blood pressure, check the BP every day at the same time. Encourage compliance with therapy, very important. Like I told you, you have to take your medication. If this medicine doesn't work, we have to change you to some other medicine, but medicine is going to be must. I've had people who, when they come to the hospital, their blood pressure is normal, say probably 120/80 or on the higher normal, or 130/90. They don't take medication, fair enough. You are, because on medicine the BP goes to 120/70, which is normal. Couple of years down the road, we do a health check and then we realize the changes which have come because of persistent high normal blood pressure, which is 140/90 all the time. So we need to, we see the changes where the blood vessel in the eyes have started becoming thicker, the heart is becoming and coming under pressure, it becomes bigger, what we call as left ventricular hypertrophy. So we can only pinpoint the blood pressure which is being checked. What about all those hikes in the blood pressure when we are not checking the blood pressure? Say when you are crossing a road, your anxiety can, when you are in a high emotional outburst is there, when you are in a stressful condition, lack of sleep, excessive alcohol, travel times, all these things are going to increase your blood pressure transiently. That means for a short period of time, but that effect remains. and we are not checking blood pressure at that time. So one of the best way to check is go on a 24 hours ambulatory blood pressure monitoring, in which we tie a cuff on your hand and we give you a gadget to hang around you. I know it's very cumbersome, but one of the most easiest to check is every 20 minutes the cuff inflates on its own and it records the blood pressure, and believe me, you would be flabbergasted at the time number of times we see that the blood pressure actually goes up in people who are hypertensive, of course. Then the other thing which we definitely need to do is an annual eye check, because eyes are the window to the kidney. We cannot check what is the blood pressure changes or the blood vessel changes which is happening in the kidney, but whatever change is happening in our eye, in our retinal blood vessel, is what is exactly happening to the kidney also. You realize if you don't make those changes and control your blood pressure, it is going to create a long-term renal failure problem. Yeah. In the diet, we need to encourage how much ever diet changes. No change in diet goes waste. It is very, very, very important. So avoid pickle, anything which is going to add to the salt load of your body. There are two reasons why we ask you to increase or cut down on the salt. The one thing is that salt retains fluid in our body. When, God forbid, your heart stops or the pumping effect goes, you start retaining fluid, then we cut down on your salt. It's going to be very difficult to eat a saltless diet. So slowly start getting used to eating less salt. Salt is hygroscopic, it absorbs fluid. You keep a spoon of salt outside, it becomes wet in a couple of hours time, and the same thing. So we are adding more fluid to our body, it is going to add more pressure to the system. If a heart is supposed to only beat this much number of times per minute for a 7 liters of fluid, try imagining adding another liter to already a stressed out condition. Then the third thing is that whenever we are going to add more salt, it is going to add more fat, because there is going to be more oil, more processed food or gluten or whatever, and these things are just going to keep adding to the problem, which is basically just starting out with hypertension. Then we are adding cholesterol to it, we are adding blood vessel changes to it, we are adding a heart attack to it, we are adding a stroke to it. So the easiest thing to say is salt restricted diet. So just go ahead and do the salt restricted diet. So you cut down on pickle, laplam, potato chips, cold cuts, all these. Everybody thinks that the cold cuts are good, but cold cut is salt laden, sorry. Avoid adding salt on anything which is cooked. Whatever is cooked in your house, that's it. You're not going to add any more salt to that diet, even to ensure that it tastes better. I have had my uncle who tells me, you know what, why are you adding salt? You are hypertensive. No. And the uppu pottadan konjam the taste varudhu. We don't need that taste, because in the long run, you're not going to remember the taste. The body is not going to remember the taste, but the body is going to remember your elevated blood pressure. Foods high in cholesterol and saturated fatty fats, say for example burgers, pizzas, kathi rolls, all these things are high salt. In the patient education, the most important part is the reporting the adverse drug reaction. Any medication which is given to you, we doctors cannot visualize that this medicine is going to create problem. Let me tell you something very, very clearly. Medicines are in the market or they are out for patient usage only after testing the safety and the efficacy profile of each drug. But that does not mean it may not have an individual side effect or an adverse reaction to one particular person. We need to report it. If not this medicine, you will be on some other medicine. There are a huge bundle of medicines for blood pressure, and every 2 years there is a new medicine which comes up. The research goes on. So please report if there is any medical problem, any issues with the medicines you take. So being aware of the fact that you have blood pressure, high blood pressure, being aware of the fact that you need to be under treatment, strategizing the risk for heart attack and stroke, strategizing your family history, your lifestyle, your personal weight and diet issues, and medication and adherence to therapy, what forms the whole gamut of treatment and management protocol for hypertension. Very, very simple if we accept it. Acceptance is the most important part of any medical problem. So, with that, I will, I'm open to questions. Is there any question? You have sent, 1 second, just excuse me. Okay. Oh, 1 second, 1 second. Sorry, I have to use my, okay. What is the DASH diet? Is it helpful? Yeah, DASH diet is essentially diet against hypertension, and we, just 1 second. Yeah, so dietary approach to stop hypertension, it helps, yes. So when you cut down on the salt, when you cut down on the oily food, when we stop taking diet which is aging our body, is what is going to help the hypertension. But believe me, it will only help if we catch it on early. Are flax seeds and garlic good to reduce BP? Flax seeds and garlic are good for the cholesterol. They are a good omega-3 fatty acid, and they are good for cholesterol, not for the blood pressure. Because if you are going to add, make the flaxseed powder and put it in your rice and eat, along with a dash of nice oil, gingerly oil and salt, there goes your diet. So, no, you can have flaxseed which is good for you, but for the cholesterol, yeah. What all basic exercise we should do when we are on a business trip? Oh, this is something which I really, that's an amazing question, now very important. The one thing which we should adhere to is our routine. Come what happens, I have my shoe with me, and the minimum I am going to do is 4 to 5 kilometers of walk or a 45 minutes of workout every day wherever I am. I don't think there is any place on the earth where we cannot go for a walk. Unless we get into that type of a mindset, it's very difficult. So you can do all your basic exercise, talk to your trainer, talk to your yoga person, they will tell you just need a mat and a shoe, that's all. What do you do when you feel dizzy after eating food? Does that mean, okay, feeling dizzy after eating food can be multiple issues. It can be because of sugar, it can be because of a gustatory reflex. You need to get checked. If it is because of blood pressure, unlikely. Usually BP goes up if you are not eating or you are fasting. So, right. Can blood pressure change between different body position? Now, it can, the systolic blood pressure can change. It's very, very variable, and it can cause giddiness, and that is what is called as vertigo or benign postural hypertension or hypertension. It can fluctuate, but usually it will fall, not go up. Even if it is on the higher side, we treat the vertigo, and if the BP settles down, then we are good. But after treating the vertigo, does the blood pressure doesn't settle down, that means it is more because of hypertension than because of any other cause. Yeah. So I'm going to just continue talking, and yeah, I'm going to keep yeah. So please let the questions keep coming. I am okay. So like I said, it is important to keep having a good routine. It is important to have a good control of your blood pressure. Blood pressure is not something which we need to be scared of or avoid medication. There are n number of good medication depending upon what you need, what are your risk factors. We can use a ARB or a ACE inhibitors or a beta blocker. And the most important part which I very, very strongly feel is, don't do any googling before you meet the doctor. The doctor is sitting there for the last, we are all, most of the doctors after dying, minimum RMO or a registered medical practitioner would have also done an MBBS and knows what they are studying from the books. They don't need the Google Gyan. And the Google Gyan is only half baked, because you won't know how to interpret it for you. You know your body, but the doctor knows the hypertension. So believe, trust your medical, advisor to do the right thing for you, right? You have a doubt, ask. one time, second time, third time. But if you're not confident about the answers you're getting, take a second opinion. But adherence to treatment is something which is very, 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 very important. Does BP change with age? Yeah. See, the whole blood pressure thing started with saying that we need to only treat high blood pressure above the age of 60. But then we realized that even people who have high blood pressure in the younger age, it is going to be there for more longer time, and it is going to create more havoc in the person's system. So people who have been essentially normotensive or normal blood pressure, because as we grow older the blood vessels become thicker and stiffer, the BP can go up. We do not bring down the blood pressure to a very, very tight control in elderly people, because it will create problems for blood supply to the brain. So remember, above our heart, especially to the head and the brain and all, the head and neck portion, the blood is pumping against gravity. So you try to control the blood pressure too much in elderly people, then it can cause lot of giddiness and stroke. It can cause infarcts, it can create other problems. So we don't do a very tight control of blood pressure. It all depends upon how much target organ damage, whether the kidneys are good, their heart are good, the brain is good or not. These things also add up to the treatment required protocol. Excuse me, sorry. How should I feel in a day-to-day basis if I have high BP? You will feel extremely fatigued, irritable, have headaches, have giddiness. When you may develop a pain in the nape of your neck, and you will be attributing it to posture. But you have to understand, like I told you again, that the blood is pumping against the gravity here, and this neck is a very good trigger point for the headache. Yeah. What precaution should I take when BP is 160/400? More than the precaution, it is important to treat it. We need to bring the blood pressure down to 120/80, and then yes, the diet, the exercise, all those things do work. Are there any foods that increase the BP? Yes, anything which has got high salt increases the blood pressure. So, yeah. Yeah. Okay. Yeah. So, complications of blood pressure, we have cardiac failure. So, the pump effect, the pumping effect, or the pumping function of the heart keeps going down. The heart becomes thicker, what we call as left ventricular hypertrophy. So if this is your heart, the heart will become big. But if the heart is becoming big, it is not being supplied with the blood it needs to maintain its function. So eventually the heart is becoming big, but it is not healthy. The muscles are not good, so it will stop pumping, and if it stops pumping, then the fluid accumulates in your body, and so that is heart failure. Then it can cause brain hemorrhage. That means the blood pressure is so high that it goes and bursts, because our brain and our head is a tight compartment. It is restricted space, so there is no place for the pressure to go up, and it will burst. Then it can cause eye damage, retinal damage, and you develop blindness. Hypertension is one of the commonest cause of blindness. Glaucoma is another part of the blindness. Then renal failure, kidney failure again. Then you develop all these vascular problems in the leg. You develop hypertensive ulcers, you develop bleeding problems and all. So these are the basic 5-6. There are variants in and out of it. So complications of blood pressure is what we are trying to avoid by treating it and including encouraging the lifestyle modifications. Anything else? If your blood pressure improves, you need to stick on to your diet and your exercise, whatever you are doing, which has made your blood pressure become better, because going back to your old habit will going to increase your blood pressure all over again. So that is not a option actually. Yeah. Why is blood pressure observed in men? I think because men come forward and get it checked. It's not that it is not there. Women are scared of changes. Women till recently were unfortunately the neglected health care, home care takers or and all. So the question of getting the women checked much later in age, when they become mothers or grandmother. A young woman voluntarily does not come and get her blood pressure checked. There is a very important aspect of women in pregnancy, what we call as pregnancy induced hypertension. The blood pressure goes up during pregnancy, and after 4 or 5 years of post pregnancy, if the weight, the lifestyle modification is not good, the diet is bad, then there is a very good chance that the blood pressure comes back again. So it's not that it is common, but yes, definitely more easily picked up in men than in women. Yeah. So yeah, so the whole point of this discussion was to make people aware that hypertension was, is, and always going to be in our lives, and we need to handle it. So we at MGM, what we do is we stratify the risk. We ensure that we sit across a table and discuss, and well, of course the choice for treatment is yours. Most people, once they understand that this is a long term chronic problem, they stick to the protocol, and they adhere to the treatment, and which is really appreciable. We have a lot of young people coming up with questions and their doubts. Resisting treatment is not a very smart move, but it's your choice. So we at MGM are always open. We have very robust health check plans to stratify your risk, address your hypertension problem, and to ensure that we are able to prevent complications. And at the end of this talk, I would, is there one more question? 100%. The BP becomes normal only because you're taking the medication. No questions. There is no ambiguity here. Unless we find that that medication is creating a problem, then we change the medication, but stopping medication is not an option. Okay, right. Thank you very much, and I really appreciate Reliance Insurance to give me one more chance of giving this talk, and trying to spread the message of hypertension and treatment. And I'm available for any more queries, so please go through the Reliance, that the same link you can use. Please send your queries, any queries which I have not answered in my talk. I'll be happy to take it up at the end of it or any time. So please feel free, and please visit us at MGM. We are always here to take care of you. Thank you very much.